Now, this story, blood banks are running critically low countrywide with less than 3 days of stock left. Now, the blood service is appealing for donations. To tell us all about it is Karin Van Den Berg, who's going to also be telling us what we can do to help in any way. Karin, good afternoon. I mean, less than 3 days of stock available. That's really, really low.
Yes, indeed it is. In fact, we are sitting at about 2.3 days stock, which is really troublesome for us. The WHO recommends that a country maintains a 5-day supply so that you can be sure that you can provide for all kinds of emergencies. And as one can see, or as one can know, during the festive period, we have increasing motor vehicle accidents, a lot of trauma that requires blood. And so we are really in a very, very critical situation at the moment.
Karin, could the blood service not have anticipated this challenge earlier, or has the pandemic affected you negatively in terms of people coming forward to donate? You've seen maybe a lot of more hesitancy, or there's been a reduction in donations because people have been sick?
So yes, we do anticipate there being a slight reduction of blood supply during the festive period because, like myself, everybody goes on holiday. And then, donating blood is not front of mind for people. And we have put started many initiatives to help prevent this. But the start of this new wave of COVID has meant that we have had less access to our donors. And in the past, what has happened is that during these waves, the use of blood in the hospitals also decreased because COVID patients don't generally use a lot of blood. But this time around, the COVID patients are actually not getting, and from what we hear anecdotally, not getting that sick that they require hospitalization. And we still have all the ongoing trauma that we see during this period normally. And as a result, we've been unable to get to our donors, in part because of the holidays, but largely because of COVID. Our staff complement has been devastated by COVID as well. And we haven't seen a reduction in the utilization that we would occasionally also see in terms of elective surgery and elective treatment of patients during this period of time. So it's just been, unfortunately, a perfect storm for us.
Yeah, it's not looking good. It's not sounding good. 2.3 days is very little. WHO, you says, recommends you should be having about 5 days of stock available. How do you get back there? Is the blood service thinking of other ways of encouraging people currently to come out and donate?
Yes, obviously making people aware of the shortage through interviews with the media, and we are very grateful for people hosting us. So firstly, raising the awareness. So we'll be going out on national appeals, regional appeals through our radios and television stations. Secondly, also, it is a difficult time for people to take time off to come and donate. So we want to reward people, to say thank you rather, by giving them a small token of appreciation. And also, we are extending our times that we are collecting blood so that people can come either before they go off to the beach or go off to the malls or afterwards. And also, we are going into places where we would not normally go and trying to get directly to our donors. So we, for example, will go into housing estates, which we haven't done much in the past. All of this in an attempt to make it as easy as possible for people to come out and donate.
Okay. Now, who can donate? And you can double click on that. Below that question would be, can an unvaccinated person, in terms of COVID-19, donate blood currently?
So the general eligibility requirements for somebody to come and donate blood is that you have to be older than 16, and if it's your first time donating, preferably younger than 85, generally in good health, and live a reasonably safe lifestyle. But in terms of COVID, we would accept both vaccinated and unvaccinated donors. And so while we as an organization very, very strongly support the call to vaccination for everybody, We know that the blood, both from vaccinated and unvaccinated donors, are safe for our patients. And so whether or not you've been vaccinated, you can in fact come and donate. And if you are getting yourself vaccinated, which we very strongly urge everybody to do, you can come and donate the very next day. If you're having slight symptoms following the vaccine, that sometimes happen, as soon as you feel better, you can come and donate. We don't have any period or deferral period after vaccination.
Yeah, I remember some time ago, many years ago, I don't know if it's still the case or it was an urban legend, that if you went to donate blood, you get a nice bottle of something cold to help you get back some of the liquid. What do you offer nowadays, Karin?
So we do, the COVID has been an absolute played havoc. One of the danger areas in contracting COVID is eating and drinking together. So what we have done now is that we have some really nice cookies and some nice cold drinks. On occasion, we partner with some restaurant chains, and then we have a pint for a pint appeals. But we do try, and especially over this period of, the year where, it is a time for giving and for recognizing. And so we do also try to, depending on where you are and how many donations you've made, there is always a small little appreciation over this period of time, just to also say thank you to everybody.
Yeah, and you've got various centers around the country which will be open currently, I guess, Karin, but people can find out where by going on your website, which is sanbs.org.za, or they can call 0800 119 and 031. I think that's the number, and those details for our viewers are at the bottom of your screen. Thank you very much, Karin, and hopefully people will take up the call to please go and donate blood. The stocks are very low at the moment, 2.3 days available instead of the recommended 5 days stock, according to the World Health Organization. Do your part,